Attendees are in listen-only mode.
Hello, everyone. My name is Anna Maria Roche. I want to thank you for joining us today for our webinar entitled Green Prescriptions, Best Practices for Success. Joining us for this webinar are Skye Cornell, Chief Programs Officer at Wholesome Wave, and Ellie Fausold, Food Access Specialist at DC Greens, and also Erin Sanders, who's helping us to facilitate our webinar today. We're going to go ahead and get started with the presentation. If you have any questions, please make sure to hold them until the end of today's presentation, as there's going to be an opportunity at the end for questions and answers. I'd like to go ahead and introduce our first presenter, Skye Cornell. She is the Chief Programs Officer at Wholesome Wave, which is a national nonprofit working to empower underserved consumers to make healthier food choices by increasing affordable access to fresh, local, and regional food. As a member of Wholesome Wave's executive team, Ms. Cornell is responsible for building diverse alliances and strategic partnerships. In 6 years with Wholesome Wave, she's developed a leadership role in scaling innovative programs to 46 states, plus Washington, D.C., and the Navajo Nation at over 750 farmers markets, retail outlets, community health clinics, and hospitals in a way that honors unique communities. Skye draws on a business, brand strategy, and marketing background. Formerly, she worked with Unilever, Nestle, Mead, and Royal Bank of Scotland, receiving several brand and industry awards for excellence. Skye also received her Master's of Business Administration from Sacred Heart University. So with that, I'd like to pass it over to Skye.
Hi, thank you, Anna Maria. I would like to confirm one more time that you guys can hear me. Is the volume working okay?
Sounds great on my end.
Okay, great, thank you. All right, well, it is an honor to be here. When Anna Maria reached out to me, I was thrilled to hear about what is happening at 31 WIC offices across the country. So I already know this is an amazing group of innovators, and I'm looking forward to sharing some of what we've learned. I hope it will be helpful, as well as learning from each of you. So I'm looking forward to hearing what questions you might have, or what challenges you're facing, or the the greatest successes. Of course, we always want to celebrate those. So I'm going to start with a little bit of background about Wholesome Wave. If you can go to the next slide, this is our vision and mission slide. Those are always a mouthful. I usually say that at Wholesome Wave, we really believe we can transform health by making fruits and vegetables affordable to everyone, and thereby addressing the challenge, the major challenge of affordability that so many low-income families have across the country. And to give you a sense of how we work toward that vision and mission, the next slide shows a map of, I think this is slightly outdated, but it shows a map of a lot of the work that we do. And our programs range from SNAP incentive programs to the fruit and vegetable prescriptions, which we'll talk about here. And we're working more and more with groups like food hubs, hospitals, and others who really want to change health across the country. Slide 4 is something that many folks on here may be familiar with, but I always like to start with it because I think it's a great representation of the challenges of food insecurity, and how on the right-hand side, food insecurity really causes diet-related diseases, and on the left-hand side, going into how food insecurity really impairs self-management of diseases. For example, we know that many, up to a third of adults who have diet-related diseases need to choose between buying medication and buying food. And that, of course, would impair their ability to manage their disease. So with that quick background, I'd love to delve into the programs. The fruit and vegetable prescription program, which is one that we've helped to start up in now, I think, about 15 states. And we've worked closely with many other states many sites. And I decided, based on some of what Anna Maria told me, that it would be helpful to kind of go through the story of how we've evolved in working with the fruit and vegetable prescription program since 2010, and to share some of the best practices that we've learned in that time. So in slide 6, the first thing we're often asked is, what is a fruit and vegetable prescription program? And if I understand correctly, hopefully I do, there are several different types of non-pharmaceutical prescription programs happening in this collaborative. So I thought I'd first be clear here that the particular fruit and vegetable prescription program I'm referencing is a prescription for fruits and vegetables. It provides an actual financial incentive for the fruits and vegetables. Largely, these programs are for free fruits and vegetables, although sometimes there's a steep discount. We've always worked with a healthcare provider. That has changed over the years, and we've grown to take as much of the program outside of the clinic as possible, but we continue to work a lot with primary care providers for recruitment, and have really broadened our definition of healthcare provider to include nutritionists and dietitians, community health workers, and so many others who are reaching patients regularly. Other core aspect is nutrition education resources, ensuring that there are accessible retail locations, whether that is a grocery store or a farmer's market. And the last one is that we really recommend that there's a clear evaluation of the program, and that there are reoccurring points during which the patient meets with the healthcare provider. So it looks like we have maybe a few questions. Do we have a question about what slide we're on, or is that set? It looks like we're on the right slide according to what I was thinking. So I'm going to, I guess I'll move on. It's always a little hard when you can't see people's faces, but I'm trying to follow the questions as they come up. So
sorry to interrupt for just a second. We had an issue with the slides, but I think that we are back on track now.
Oh, okay, great. So the next slide, slide 7, speaks to, we could consider our work in 3 phases. And this is, in 2010, we really just started with a feasibility study. We wanted to test a concept about if we could build effective partnerships between healthcare providers and farmers markets, and to understand if participants would actually redeem prescriptions for fruits and vegetables. We're happy to say that it was a positive. We chose to work with farmers markets in part because there was greater access in the particular community at the federally qualified health center that we were working with. And we quickly learned from providers that this was very powerful for them. It gave them a tool to address affordability, which was the core challenge that they were facing with their patients after they would make recommendations for healthy eating. So they could really have, they advised us more genuine and authentic conversations with their patients that led to improved health. One of the questions that Anne Maria wanted me to cover was what are some of our best practices learned about partnerships over the years. So I'll use this opportunity in this phase to talk about it, although we continue to learn. So one of the key lessons we've learned is that it's very important to have multiple champions within on the healthcare side. Basically, we always prefer to have a champion on the administrative end, as well as a champion provider. We found that if you have just a champion who is an administrator, that often the providers will feel like the program is kind of pushed at them and that they don't have a choice in it, and they're not as enthusiastic or happy about running the program. And the other way around, you really need to get the buy-in of the administrator, obviously, to get approval for the providers to spend their time on such a program, as well as coordinators or others who are associated. So that's one of the major lessons that we've learned, that you want to spread across an organization. Also ideal is to be able to hook into multiple goals on the healthcare side. So we found that particularly, say, if you're working with a hospital and they have a community health needs assessment, if you're able to speak to diet-related disease, as well as food insecurity, as well as any goals to address building clinic community relationships. Basically, the more goals that you can hook into that already exist within the hospital system or within the clinical system, I realize you're not all working with hospitals, the better. And sometimes this takes some searching, because the people that you might work with in the clinic might see you through one particular lens. But if you can take the time to identify a variety of different ways, then that is great, because again, you can get more champions and you can get more buy-in throughout the organization. The third lesson we've learned is the importance of setting clear expectations and achievable goals up front. So you'll see in any of our toolkits or the new tools, the new materials that we're putting out, that we have a very clear list of the expectations from each of the partners in the partnership, from the retail and to the any community-based organizations to the clinic. It's all very clear up front. And the final lesson we've learned, because this has happened to us quite a few times, is that if the administration of a clinic, or if you're dealing maybe with a city or state run clinics, if the government administration changes, you can really expect the goals of the clinic and the people who are in the clinic to change, and you want to really address that head on. You start talking to people as soon as possible, figure out again who your new champions might be and what goals for the new organization that you can hook into. And we found that really how you navigate those changes and really refine and see what you can shift, while of course still staying true to your goals, will play into your success over the long term. So those are 4 lessons that we've learned about partnership. And with that, I'll go into the next slide, the 8th slide, to talk a little bit about what we learned in phase 2, which was the implementation of a static model. And here we really worked on refining the program design and aggregating data to demonstrate impact. We worked with many groups across the country, including Ellie, who you'll just hear from you'll hear from next in DC. This was a very particular model because we were trying to gather specific data, and that model, as you can see in the next slide, was very much more heavily based in the clinic, where patients were recruited by providers. They had repeat visits every month over 4 to 6 months, where they received their prescription program, and there were health indicators collected at those visits. They received nutrition education also at the visits, and in between, the prescriptions were redeemed for fresh fruits and vegetables. We had some great success with that program over the years. As the next slide shows, we saw that there were health improvements. There were a significant number of people who said that their quality of care increased. There was funds, dollars going back into the local community, supporting farmers, and we found that when people would come to the markets, they would shop in the community as well. And we saw that there was a lot of food security improvements over the course of this program. So at that point in this phase, we really felt that these results told us to keep on going. However, we'd also learned a lot about the program design and started to ask ourselves things like how much of a burden are some of the components, how can we streamline and improve them? So in 2014 and on, we look at that as our adaptation phase. And we started to identify that we needed to do things like fine-tune the message, standardize the program materials to make it much simpler for clinics and community-based organizations and markets and retailers to start these programs up. And we needed to really decrease the burden on the healthcare provider, as well as look at the amount of nutrition education that was needed in order to have impact. So in 2014 and beyond, I won't get into too much of this, but we started to really expand from working on a population that was largely focused on children who were obese and overweight, to working with adults with diabetes, and to working with grocery stores, to working with hospitals and others. And I know we don't have a lot of time, so I'll just jump to slide 13 to give a great example about these adaptations. This was a program in Los Angeles that we ran just last year. It was a partnership with Target grocery stores, as well as 6 farmers markets in Los Angeles, Eisner Medical, and another local group called Grocery Ships, which provided some nutrition education. Through this program, we were able to reach, it was actually, the end number was over 550 families. They received a comprehensive multi-pronged program that provided both incentives for fruits and vegetables and varying levels of nutrition education. And we really were able to get this up and running within just a few months, despite it being, as far as I know, the largest fruit and vegetable prescription program nationally, in part because of things like, as you'll see on slide 14, kind of these standardized materials and trainings and things being kind of ready off the shelf to get started based on all those previous years of work. I'll quickly say that we have not yet published results, but it has been, we feel that it's been really successful. About 75% completed the program requirements, and the majority of those received all 3 infusions of the vouchers. So they received 6 vouchers at a time and what we called these food access guides. About 90, so many, let's see, about of the people who didn't meet fruit and vegetable requirements at the beginning of the program, we saw an increase of 182% in fruit and vegetable servings by the end of the program. Nearly 60% agreed or strongly agreed that the program helped them afford fresh fruits and vegetables, and that this had a positive impact on their children's health. And we also saw that the biggest changes were around the importance, the knowledge about understanding the importance of fruits and vegetables in a family's diet. So about 75% of people who had reported knowing very little about this subject, by the end of the program, they said that they knew some or knew a lot. So that was pretty significant. There was nearly $250,000 redeemed for fruits and vegetables over the time of this program, and that was nearly equally split between Target stores and the farmers markets. And finally, we saw that participants returned an average of about 9 times to where they shopped. So there's a lot we could say about that, but I'm trying to go through as much as I can quickly. But one of the great things to come out of this program that we're very excited about, it can show on slide 15, is a plug and play package of tools that we're able to build out of that particular program and others from learning before it. So last year we'd put out a prescriptive kind of how-to toolkit, and it was, I want to say, over 100 pages, maybe running much more than that. And it told people how to do things, and that is great because it answered a lot of questions. But this year we're producing the actual tools so that people don't need to recreate those themselves, but can just be picked up and used in the community. And we find that lots of healthcare providers like that because it's kind of straightforward and consistent. It's based on outcomes, and it helps them to really imagine how this kind of innovative approach could really work in their own clinic. So that should be released in another month or two. And I will end there, and thank you very much for your time.
Thank you, Skye. Now I'd like to introduce our second presenter, Ellie Fausold. She's the food access specialist at DC Greens, which is a nonprofit organization that works to drive long-term systems change to advance food justice in the nation's capital. Ellie manages the FVRX program in Washington, D.C., through which DC Greens partners with 5 health clinics and farmers markets citywide. And with that, I will pass it over to Ellie.
Thanks, Anna Maria, and thank you, Skye, for that really helpful overview of the fruit and vegetable prescription program. So I'm going to take a few minutes today to talk about our experience implementing a fruit and vegetable prescription program here in Washington, D.C. And as Skye mentioned, we started working with Wholesome Wave on the fruit and vegetable prescription program in 2012. So we've now run the program for 5 full seasons here in the city. So I'm having a little bit of trouble viewing the slides. I see my slides up on the screen, but I'm not able to actually move them. I'm just seeing like the static PowerPoint screen.
Okay, I might need to do it for you if you just want to say next when you're ready.
Sure. So we can go ahead and move to the next slide. Sorry, I'm still actually just seeing the first slide of my presentation. There we go. And sorry, there we go. If we can move back just one. Yep, great. So DC Greens, as Anna Maria mentioned, is a nonprofit here in Washington, D.C., and we drive long-term systems change to advance food justice here in the nation's capital. We do this by building bridges between government, private sector, communities, and nonprofits, developing advocacy channels to amplify marginalized voices, curating best practices and leveraging existing infrastructure, responding to community needs, and providing thought leadership. You can go ahead to the next slide. So here in Washington, D.C., when implementing the fruit and vegetable prescription program, we are reaching DC residents who are experiencing food insecurity and are at risk for or experiencing some form of diet-related chronic illness. So patients are referred into the program by their primary care provider, and they participate in monthly group visits from June through November. Those are the months that we run the program. It sort of lines up with the farmers market season here in the city. And at the group visits that participants attend, they receive wellness education along with their fruit and vegetable prescription. You can go ahead to the next slide. So this model probably looks familiar. We credit Wholesome Wave for this really helpful explanation of the program. So as I mentioned, patients are referred into the program by their healthcare provider because they're experiencing food insecurity and are at risk for or experiencing some form of diet-related chronic illness. Patients attend a monthly FVRX group visit, and at that group visit, they have, we collect health indicators, height, weight, blood pressure, etc. are all collected at that time. And the patients also receive about an hour to an hour and a half of nutrition education coupled with a seasonal recipe demonstration that uses produce that participants are going to be able to purchase at the farmers market using their prescription. At the end of the group visit, the patients receive their monthly prescription that they'll be able to use in the coming weeks. And then patients take their prescription to the farmer's market where they redeem it for checks that they can use to purchase fresh fruits and vegetables from vendors at farmers markets across the city. And then the next month, patients return to the clinic and the cycle repeats itself. Go ahead to the next slide. We've seen from the fruit and vegetable prescription program that it's been a really helpful tool for the health providers that we work with, because it enables patients that they're working with to be able to act on the advice that their providers are giving them to go out and consume more fruits and vegetables. It's giving them a tool to be able to actually go to the farmer's market, purchase those fruits and vegetables that their healthcare provider is suggesting that they consume. And along with that, they're also receiving information on how to prepare that produce so that they know they've got some ideas for how to use it when they bring it back home. Go ahead to the next slide. There are always a few costs that we need to consider when implementing the fruit and vegetable prescription program. So the program does require time and staff from health clinics we work with, farmers markets, the coordinating partner, which in this case is DC Greens, along with nutrition educators. Here in DC, we have seen the health clinics that we've worked with have been able to bill for the time that they're spending on the group visits at the program. So that's been a really helpful way for the health clinics to be able to cover some of the time that they're spending on the program. And then in terms of the nutrition education for the program, in the past, we've worked with students who are pursuing their master's in dietetics from the University of District of Columbia, which is our land-grant university here in DC. And we sort of ran that as an internship program for students. And this coming year, we're actually going to be working with, we're planning to work with SNAP-Ed to actually lead some of the nutrition education at the health clinics. The actual dollar amount of the prescription is $20 per participant plus $5 for each additional family member per week. So someone who has a family size of 1 will receive $20 per week to spend on fresh fruits and vegetables at the farmer's market. Someone with a family size of 2 receives $25. A family of 3 gets $30 a week, and so on. We've also needed to develop an at-market tracking system to be able to actually redeem the prescriptions at the farmer's market and be able to follow how many patients are using their prescriptions. So in the past, that's looked like sort of a spreadsheet that we kept in binders at the farmer's market, the list of patient ID numbers, and then the farmer's market could just check off each week that the patient came and redeemed his or her prescription at the market. This past year, DC Greens received a grant from the DC Department of Health to run another citywide farmers market nutrition incentive program that's running here in DC. And we developed an app for use at the farmers market as part of that process. So this past year, we were actually able to integrate FERX into that app and be able to do all of that market, the tracking at farmers markets on tablets at the farmers market. So all of that data fed back to us over the internet. We also need to supply tokens or checks or chits, something for patients to receive after they redeem their prescription at the info booth at the farmer's market to be able to take and spend with vendors. So here in DC, we use checks. Patients are, when they go to the info booth at the farmer's market, the distributor writes out checks for the patients to spend, and then they spend the checks with the vendors at the farmer's market, who then deposit it into the bank directly. And then we also need to make sure to provide materials for the nutrition lessons and cooking demonstrations, which include recipes as well as supplies and other ingredients for the recipe demonstrations themselves. Go ahead to the next slide. In 2016, we distributed a total of $66,190 to participants in the FERX program, and participants spent almost 92% of those checks that were distributed to them. We enrolled a total of 411 participants and their family members. We worked with 55 farmers markets, so really farmers markets all over the city here in the district. We worked with 3 clinic partners. So we worked with Unity Healthcare and 3 of their health clinics here in the city, along with 1 clinic from Mary Center and 1 Community of Hope Clinic. And our 2 primary funding partners on the program this year were the DC Department of Health, along with AmeriHealth Caritas DC, who's a managed care organization. You can go ahead to the next slide. So pretty consistently with what Skye shared, annually we see that between 50 and 55% of participants experience a reduction in their BMI or BMI percentile for pediatric patients over the course of the program. And we've really seen that same figure pretty consistently over the past 5 years that we've implemented the program. We also learned this year from Unity Healthcare that they saw that patients who were receiving the FERX prescription as part of the group wellness visit that was running at the clinic, patients who were receiving both of those actually attended the clinic 54% more than patients who were only participating in the group visit without also receiving the prescription. So to us, that shows that FERX really is a helpful tool to encourage patients to visit their primary healthcare provider more regularly. Go ahead to the next slide. So in our experience, we run into a few challenges and successes in implementing the program. One thing that we've learned has been really important is trying to limit the turnover from staff at the health clinics who are implementing the program. We've seen that when there is turnover in staff who are overseeing implementation of the program at the clinic, it just doesn't allow participants in the program to develop the same sort of relationship with that provider who's overseeing the program as they maybe otherwise would. And with the group visits, providers are also, or staff at the clinic are also calling patients every month to remind them to attend the group visit. And it's really helpful when that's the same person over the course of the program, so that the clinic staff member knows the patients who he or she is talking with, and the patients also are familiar with and comfortable with that staff person who they're having regular contact with. As I mentioned, this year was also the first year that we were able to use an app to redeem prescriptions at the farmers market. As with a lot of technology, with it being the first season of rolling out this app, we did experience some tech glitches. Overall, it was really helpful to be able to have the data fed back to us pretty much in real time from farmers markets all over the city, but it wasn't perfect. So that's definitely something that we're working to improve for this coming season. And we've always found that it's really important to thoroughly train farmers market staff and volunteers so that they're well versed in how to actually redeem the prescription when patients come to the farmers market, so that they're well equipped to be able to answer questions that patients might have about how to use their prescription or what they can purchase with the checks that they receive. So we found that really thorough training there is always important to make sure that participants in the program have the best experience possible when they go to the farmers market. In terms of successes, we've been fortunate to have some really great funding partnerships through the program. As I mentioned, we've had support from the DC Department of Health, along with AmeriHealth Caritas this past year. We've also found that implementing this program using this cohort or group visit model has been a major success of this program. One, because it helps to sort of lessen the staff time required from the clinic on this program. They're able to see all of the participants in the group in the program at one time, rather than needing to schedule individual appointments for all of the participants in the program. So that's been hugely helpful, and it's also been helpful for the patients, I think, in that it helps to sort of develop a natural support network and connects patients in the program with other people who are working towards the same goals that they are. And even though we're only able to run the program from June through November right now with the farmers market season in DC, I've actually heard from a few patients that they've been interested in continuing like some sort of regular group get together with folks who participated in the program with them, because that support network was, they found that support network to be really valuable. As I mentioned earlier, this program has also helped to improve patient retention at group visits at the health clinic. And it's enabled patients to develop strong relationships with farmers market staff and clinic staff as well. We've talked about the clinic staff a little bit, but it's also been really valuable for patients to be able to develop relationships with both the farmers market managers, who are able to sort of help answer questions about the farmers market and help guide them through that space, as well as developing relationships with vendors at the farmers market, and being able to have a real connection to where their food is coming from. And actually, one of the, a teenager who was participating in the FERX program a couple of seasons ago was able to develop such a strong relationship with one of the vendors at the farmers market he was participating, or that he was visiting regularly, that the vendor actually offered him like a seasonal position helping to run the stand at the farmers market, which is sort of just really, it's been great to see that the patient was able to develop such a good relationship with that vendor. You can go ahead to the next slide. This program has also been a way to address some social determinants of health. This program has helped to increase access to nutritious foods in neighborhoods of the city that are identified as food deserts or areas of low food insecurity. This program helps patients develop stronger relationships with their healthcare providers. It works towards patient compliance with well patient visits. We've been able to provide translation of materials for non-English speakers, and have been able to support access to nutrition education. Go ahead to the next slide. So as I mentioned, we've had funding support from the DC Department of Health, from AmeriHealth Caritas DC, as well as the Hillside Foundation and the Family Alliance Foundation. And for us, we always try to implement this program with a vision of sustainability. And for us, that vision looks like all healthcare providers in DC being able to screen their patients for food insecurity and risk for developing diet-related chronic illness. And then if the with questions,
Aaron's computer is restarting right now, unfortunately. And I think we're online now. Was able to get back on. Hopefully she can get back on, but of course, if you have any questions, we will have our speaker's contact information to give out to you, and you can speak to them directly. I'm getting a notification that's saying that if Erin doesn't sign on, then the webinar is going to end in 5 minutes. So I'm going to give some time for her to come back on, but if not, we can conclude the webinar, and then I could send our speaker's contact information to everybody. Okay, it seems that Erin is back on, so if you guys have any questions, please feel free to either type them in the question box or Erin can unmute you.
So we have a question from Emily from Truman. It says, can you speak to sustainability in funding of the voucher for fruits and veggies? Where do you see funding long term?
Was that a question for Skye or for me?
Oh, it didn't say.
Sure. Well, I can speak to it for a second. Sure. I think that long term, I mean, ideally, I think we'd like to see prescriptions for fruits and vegetables integrated into and recognized as part of preventative health care. I know that there's a currently starting to be a shift towards value-based care and a shift towards more preventative health care. And ideally, I think we'd like to be able to see prescriptions for fruits and vegetables recognized as part of that, recognizing that access to healthy food is really a vital component of someone's health.
Thanks, Ellie. And I think Skye also wanted to add to that.
Hi. So yes to everything that Ellie mentioned. We've been trying to, well, we've been aggregating through our National Nutrition Incentive Network some of the approaches that different groups are taking across the country to lead towards sustainability. So there's a few that seem to be particularly promising. One is there have been a few cities that have taken on some of the funding of these prescription type programs. New York, who had been supporting SNAP incentives for years, expanded to more of the fruit and vegetable prescriptions. San Francisco, we're seeing some different types of prescriptions happening in DC as well that Ellie would know at more detail than I would, but that's one approach. We're also seeing hospitals through community benefits dollars based on the community health needs assessment, supporting some of this work, and that of course plays into the approach for prevention that, as Ellie mentioned, is having more and more part of the discussion with food access and prevention together and the world of healthcare. And finally, one thing that we've just started to see that's been really interesting is through the CDC, which I know this group is already working with, but through one example in Ohio through the State Health Improvement Plan, a group of, I want to say, public health nutritionists, but I might have that wrong, began to work with the state on their preventative health block grants. I'm not quite getting the exact block grant right, but because they were able to write these approaches for incentives into their state health improvement plan, they were able to identify 3 different funding sources, and one being the CDC's preventative health block grants that they were able to start to use toward more sustainable funding for these programs. And then there were some matching funds, I believe, coming in from the state. So those are 3 ways that we've heard that are more and more sustainable that might be of interest to this group. And we're always interested in any other examples that are out there.
Thanks, Skye. So Emily had 2 follow-up questions. One was, how important is the financial subsidy or voucher as an element of success? And then secondly, do you have any long-term data on fruit and veggie consumption or other health outcomes after participants complete the program 6 months out or later? Skye, if you would like to start, you can. Otherwise, I could switch it over to Ellie.
I could start there. We believe that so we have not run a prescription program without a actual dollar amount or actual financial incentive. So that's important for me to say. But we think that it's critical. We've heard from healthcare providers that it's the biggest barrier that participants in low-income families face, and that without addressing that barrier, they really can't address any other barriers like food access or needing changes in education. Things like that are really helpful, but they're challenges that can be addressed once the barrier of affordability is addressed. So from a Wholesome Wave point of view, that's really critical piece. Long term, we have a few good indicators, and it's clear that more research is needed. There's a great group out of San Francisco called Fresh Approach. We began working with them, I think, around the same time that we began working with DC Greens, and they've done some initial follow-up like a year after their program that showed that somewhere around 80% of people continued to be able to have an increase in vegetable consumption, particularly. That jives with what we found on some of our other incentive, like SNAP incentive programs, that vegetable consumption can remain high. We've also learned from participants that some of the knowledge that they've received as part of the program has really has been important in helping them to continue to make change. So things like learning how to read labels, and the importance of eating dinner with the family each night, and kind of eating more slowly and not rushing through the meals, or how to make really easy, quick meals that might be able to be an alternative to a stop off for fast food on the way home. So we've seen those as really good indicators that this type of behavior change can continue, because and a lot of these nutrition education programs include budgeting aspects as well. But ultimately, we feel that having the healthcare system move toward prevention and toward being able to provide these types of incentives is really a critical direction to go in. We're also looking to do more research. Hopefully, we have a few grants submitted to do something to be able to have control groups where we follow up on and get these types of questions answered.
Thank you so much, Skye. Ellie, did you have anything you wanted to add to that, either about the need for subsidies or about health outcomes?
Sorry. Yep, I was muted. Yeah, I definitely echo everything that Skye said. From our point of view, providing that financial incentive is really a critical part of the program. As I mentioned, we're working with families who are experiencing food insecurities. So being able to provide them with money that they can actually spend at the farmers market to be able to purchase the fruits and vegetables that their healthcare providers are recommending is really, really essential to be able to enable them to act upon the advice of their healthcare providers. We have not yet done any follow-up research with participants after they've completed the program. But one thing I will add to what Skye mentioned was that we have seen from surveys that we asked participants to complete at the end of the program that participants are consuming more fruits and vegetables. They enjoy, or they say that they like fruits and vegetables more than they did when they began the program. Maybe being able to try new foods that they hadn't tried before. And patients also say that they're more comfortable shopping at the farmers market, which I think is something that's really important to keep in mind, that farmers markets can be a really different type of shopping environment for folks who haven't shopped in that space before. So we offer farmers market tours for patients at the beginning of the program, sort of help guide them through the process of how to navigate that space. And I think that's one part of the program that sort of opens up a new option for them as well, in terms of where they can access fresh fruits and vegetables in their community.
Thank you, Ellie. If there are no other questions, we can conclude today's webinar. I want to thank our experts, Skye Cornell and Ellie Fausold, for sharing your great wealth of knowledge regarding these fruit and vegetable prescription program initiatives. I also want to thank all of our subrecipients for your participation in this webinar, and I hope everyone has a great weekend.
Hi, thank you.
Thank you.